Sara Gorton, who's head of health at the trade union UNISON. Thanks very much for being with us. So as we were hearing there from Jim Reid, I mean, big increases in many hospital trusts in staff shortages, up to sort of 1 in 10 members of hospital staff who are absent because of COVID reasons. That's just adding to all the pressure on the NHS.
It is, and drafting in the military today is yet another sign that we've now got a persistent staffing crisis where we're not able to cope with predictable staff absences. We had the military called in to support ambulance crews over the summer just to be able to give the full-time staff their annual leave. So calling on the military today, I think this shows that the government knows it's got to be seen to be doing something to fix the staffing crisis. But I think that health staff would see that as a more genuine attempt to help if it came together with a promise that the government will fix some of the underlying problems that led us here.
So you're saying these are longer term issues. This isn't just a short term issue because of Omicron. It's a longer term problem with the health service, with staffing and not enough staff in the health service.
Completely, and the risk is that this will all be disguised as pandemic related, whereas yesterday there was a report produced by a parliamentary body that showed just how desperate the staffing situation is. And our assessment is that the most critical factor, the most urgent actions that the government can take is to stem the tide of staff leaving the NHS. So we know that in London alone last year, 24,000 people left. A survey that we did at UNISON just before Christmas showed that 3 out of every 10 health workers are currently actively looking for work outside the health service. So stopping people leaving is the one critical action that the government can take to help the NHS and to start to recover from the workforce crisis.
And just give us a picture of what it's like to be a health worker now. After 2 years of this pandemic, I mean, it's already been exhausting and traumatic. And now those who are at work because, they don't have COVID or they're not isolating, they're facing these huge staff shortages. Presumably their workload has increased because so many other people, so many colleagues are absent.
That's right. And there's a risk that this creates a kind of complete downward spiral that as as more colleagues go off, it adds to the pressure of existing staff. And that's what's been building for the last few years. It isn't just, obviously it's got worse as a result of the pandemic. We know that people are experiencing huge levels of fatigue, and what's really starting to come through is the concern about the quality of care that people are able to give. People are going home after shifts worried about the things they've not been able to do, worried that they're not able to work to the standards that they want to deliver for patients, and that means that they are, they're put under unbearable pressure. And this isn't just one particular group of staff. We're seeing this across all disciplines. People who work in emergency services have obviously been at the forefront of this, but this is now playing out across the whole service.
But at the same time, I mean, I hear what you say about the longer term issues, but the Omicron surge isn't going to last forever. And already there are signs, I mean, it may be small comfort, but there are 16 critical incidents in NHS trusts in England today, whereas there were 17 yesterday. So perhaps the worst is over.
And the risk is that people say, OK, we're through the very worst of this. We don't need, and then move on to look at other issues. Whereas what we've been warning for years ahead of this is that the NHS didn't have the resilience in terms of staffing numbers that it needed in order to cope with this. And it gives, it's no pleasure to be in a position where we're able to say, this is exactly what was predicted. So what we want is a commitment that government will act now to prevent this being a persistent and long-lasting feature of life in the NHS.
OK, Sara Gorton there, Head of Health at the trade union UNISON. Thank you very much for giving us your thoughts.
Thank you.